Heart disease is actually one of the top causes of death among women in Singapore.
Ooh, I didn't know that.
Is it?
It is.
It is.
It is really common.
Why?
It is as common as 1 in 3. So that means there are already 4 of us sitting here. Actually,
I'm the one. I confirm I'm the one. I got heart problem.
And to discuss this, we have a doctor with us. Her name is Prof Low, a cardiologist from National University Heart Centre, Singapore, NUHCS. So, we are not doctors, so we invited a doctor to tell us more about this heart problem. But okay, 1 in 3.
Wow.
1 in 3. Thank you for having me on board. I'm so happy to be able to talk about something close to our hearts and no pun intended there.
Okay, so out of you 3,
At least one of
Me,
us.
confirm me. I got heart problem. No, legit.
Why? My question is why?
Okay, so we say cardiovascular disease actually is the top killer of women in Singapore, but many women do not know that. So if you go around asking women on the streets, what is the top killer of women in Singapore? Guess what they will say most of the time?
Cancer.
Yeah, and
Breast.
specifically,
Breast or ovarian.
breast cancer, because we associated women with a pair of breasts
Yeah.
and our private parts. That's what makes us women, right? So when we talk about women's health, most people think of the bikini parts only. The breasts and cervix, uterine cancer, and the heart is hidden right inside. But actually, it is the top killer of both men and women.
Wow.
So it takes away 1 in 3 women's life in Singapore and all over the world as well. If
does
you're
age
scared-
matter? Because I wrote the episode in 3 segments, and it's we are going to talk about the different ages, how it affects women from different ages. So let's get into that before we go into any deeper, okay?
Yep.
So the first segment is women ages from 20s to 30s. Not you.
I'm safe.
Hey, the doctor haven't answered yet.
Yeah.
Okay, doctor, answer first.
The women around this age, what are the most common causes of heart diseases?
Okay, so in the 20s to 30s, most women, men as well, will not be thinking about heart health, right?
Yeah.
It is where there are most active or maybe just out of schooling years. You could be generally, you generally feel like you could do anything you want in your life. Yeah, and the future is usually very bright at that time. And but that is actually the most important years to bank in deficits for heart health later on in life. So generally, most people are well during this age, but for those who are already affected and manifested with heart health, a lot of times it may be associated with, say, a genetic predisposition or congenital heart disease. But already for heart health, that tends to affect most of the population, that lifestyle risk factors will start having an implication already from the 20s to 30s. So it doesn't mean that when you're 20s and 30s and feeling well, you don't have to think about taking care of your heart at all.
I take care of my heart, honestly. Like I
Doing
do.
what?
Like what?
I do cardio, as in I have like specific heart exercise days. I walk, I do cardios, and then my other days are muscle days.
So that's how you take care of your heart.
Yes, that's
You have
great.
to.
Yes.
So you're saying like if you're in your 20s and your 30s, you need to exercise.
Like,
Yes,
Like
it doesn't,
how?
It doesn't
When
mean
you
like you
drink.
can eat McDonald's all the time and so cardio workout. So exactly like what you say is perfect. So there are actually good heart guidelines that advocate for cardiovascular moderate and intensity exercise, 150 minutes a week. So that sounds like quite a bit, but it's just about maybe 30 minutes a day, 5 days of a week. So the other 2 days of the week, you can do strength training.
Yeah.
And that's great for banking in deficits for heart health. Yeah.
Technically you can do it all in one day, right? Just play soccer for 2 hours.
Do household chores also can.
Yes, actually. Correct me if I'm wrong. If your heart rate is beating at like 110 to 120 while doing housework,
That
that's
is
okay.
basically cardio.
Yeah, that's like walking.
Yes,
Yeah.
any activity is better than nothing. So yes, that's right.
What about arguing with your partner and then your heart rate go up?
Oh, also cardio, right?
What are the symptoms? So from 20s to 30s, if let's say, like for example, sometimes you get heartaches Or sometimes when you run and then you feel like you cannot breathe properly, and maybe you think, oh my God, this is just a bad day. You know, maybe my lungs is not opening up more, I stretch more, I put Vicks or whatever. Then how do I know if maybe that is my first symptom of a heart disease?
Yeah, okay. It's just very interesting hearing you say that, because actually among the young people, I actually run a young people kind of a heart clinic because I do congenital heart disease. I get a lot of NS boys who get referred because when they start, if they have any intense training, they feel like maybe there's some chest discomfort or they have some chest pain when they exert, or suddenly just feel like passing out or palpitations, and sometimes that deserves some screening. Most of the time, it's just due to lack of fitness. Most of the time. But we do have cases.
You're not fit enough, dude.
No, that's not what last time. As in, I was once very fat, and then like when I started,
looking great. Looking
when I
great.
started exercising, and then as in, it was very hard for me to pick up the pace lah. So I thought, oh, maybe like I was so fat that maybe I picked up a disease. But turns out, nah.
You're just not fit.
Yeah, but some screening is needed. And so there are some congenital conditions that will manifest early, between 20 to 30 years of age. Coronary disease, coronary arteries that are anomalous. And there are some conditions that tend to affect a young age more than an older person. So I will give you one perfect example. I have young patients coming to me with shortness of breath and eventually diagnosed to have pulmonary hypertension, which is a rare condition. And that caused the right side of the heart to fail because it has to pump against high pressure in the lung arteries. And because this is a condition that affects young women rather than older people, when she goes around seeking consult with doctors, I mean, it's just dismissed, like you're young, you're either you didn't sleep enough, you are just anxious, or you're worried. So I think it's really very important for young patients, if they feel like there's anything wrong with their heart, it's just not like before they're not catching up with their peers, get a proper evaluation. Yeah, and a doctor who will listen to you and screen your heart health. Yes.
What about like really young girls? Like I hear my daughter is 14 and she tells me a lot of times that she gets these very uncomfortable chest pains, and it comes randomly, like maybe in a year, maybe 3 times. But do I have to worry about that since she's really young?
Okay, so that sounds quite benign just by that short little history, that little snippet that you tell me. If the chest discomfort is infrequent, 3 times a year is really infrequent. If it is a symptom that is unrelenting, it keeps coming on and it's progressive and it's traditionally always brought upon with exertion, then it likely points to something in the heart. But it just comes fleeting and it goes, and then after that you can go about usual activity and good effort tolerance, then most of the time it's nothing.
Okay.
What if like someone who doesn't have any underlying heart condition, right? What are we doing that, or you know what are some things that we can do that will not lead to that?
Okay, so I would just say in the 20s to 30s, have a very good healthy lifestyle like what you're already doing. Start from
What about stress?
20 to 30s. Yeah, managing stress is definitely helpful. There is no direct linear correlation with like, you're having a more stressful life, so you're definitely more likely to have heart disease. But it affects eating habits, your ability to exercise and sleep well. So that all part of good lifestyle management, it comes all together.
I picked up sleep. So I think sleep is very relevant to all of us. I think in 1 week, probably 2 days you don't get good sleep, or 3 days you don't get good sleep, right? How many times has sleep caused a heart disease?
Okay, I would just say for sleep-causing heart disease, recently, or maybe not so recent anymore, there has been a good understanding that there's this condition called obstructive sleep apnea that is a significant risk factor for heart disease. Most people understand heart disease to be related to diabetes, high cholesterol, high blood pressure, but if you sleep poorly, like in the case of obstructive sleep apnea, where the oxygen level drops when you sleep, that has been well correlated with heart disease. So for those people who snore at night when they sleep, feel very sleepy during the day because they don't sleep well at night, or on an obese side, it's good to have some screening done. But this is not a condition that affects women more than men. It can affect anybody, especially if you are overweight. But if you're not sleeping well due to stress, then that is not necessarily obstructive sleep apnea. That's just like,
Cortisol, would you say?
Yeah, so that's lifestyle
A
management.
newborn baby.
Okay. That was actually my next question. Like, is it just the sleep apnea part, or like, is it how many hours do I get in, or how many times do I wake up in the night?
So the advocate is to have good 8 hours sleep every day. But it's so hard in Singapore.
No, 100%.
Unless you have a Scandinavian lifestyle. It's really hard in Singapore.
Actually, I mean, I spoke to a sleep expert before, and it's really just training your body to do it. There are ways to signal your body, to tell your body that it's time to rest, and that is like rolling your eyes back for 4 to 7 seconds.
No wonder I'm
Yeah.
always tired.
Yeah, so you just roll
Always
it.
rolling my eyes in the day.
Then, so it's the same tactic that they use in hypnosis. So when you go for psychotherapy and they hypnotize you, they ask you to roll your eyes back. So then it signals your body to relax. Is it correct to say that your heart is the strongest in your 20s and your 30s?
It can be
It
trained.
can also
Yeah.
be very strong in your 40s, in your 50s, and your 60s.
Okay, but does it get... Okay, let's say in the context of I'm training my heart, right? Does it get stronger?
Well, I would say that generally when you are younger, you are supposed to be in optimal cardiovascular health. But if you have poor cardiovascular lifestyle, then you will not be in optimal health. And some people pick up on a good lifestyle only later on in life. When they find that career has taken off, or family is completed, or they are reached a time in a stage where they can take time off for themselves, then they start doing things for their heart health. So it's never too late to bang in on heart health. And I think there is no good optimal time. And I've seen old folks who are really strong as well.
One thing we missed out about is smoking or even vaping, right? 20s and 30s, that's when you do naughty things. How much of, I mean, you said 1 out of 3, right? Women die from heart diseases.
Men also.
Men also, okay. How much of those are smokers?
Okay, our smoking rate is much higher for men than women. So I find that I don't really have a problem telling a woman with heart disease to say you have to stop smoking because most of the time they are not. Yes, but that also tells you that it's more than just smoking that cause heart disease. But definitely if you're a smoker, there's nothing good about it. There's all bad. So it's never too late to quit.
Okay.
Yes.
What about vaping? Have you seen anyone who vapes and has heart
I
diseases?
personally haven't yet. Maybe because my population, I don't know, they are not...
Maybe they don't declare.
Oh, they don't
that
declare,
vape.
yes, that's
Right,
right.
right.
Yeah.
It's illegal in
But it's
Singapore.
just as bad.
Yeah, I know lah, but maybe like, you know, you don't know what someone vapes and then like, oh my God, I feel like, then I go and then...
Yeah, but I do have patients who are drug abusers. And they are seeing me for heart disease related to drug abuse.
Ooh.
Amphetamine abuse and things like that, cocaine, yes. So that can affect coronary disease, can affect heart function as well, and pressures within the heart.
Wait, I have a question though, because like you said, okay, like exercising, you know, smoking or like sleep, right? But what about like oxidative stress or like example when you're somebody who you just have a very bad lymphatic, like all your lymph nodes are always stuck. Because like when I went for, I know it's super unrelated, but when I went for my lymphatic massage, my masseuse told me, you know, that if your lymph nodes are always very inflamed, then like your muscles and how do they say, like your entire fascia tissue is always inflamed. And that causes a lot of stress from your heart and your muscles in general trying to like reduce the inflammation. So do you think like, is that chronic stress? Does it affect the heart, or does inflammation in your body affect your cardiovascular health?
Yeah, so that's the thing that's a bit more unique with women, because women tend to have more likelihood to have inflammatory diseases or autoimmune diseases than men. So there are young women with more inflammatory conditions or rheumatological conditions, and that increases their risk of cardiovascular disease compared to men. And usually these conditions need to be treated. I mean, if it's a proper medical condition, it has to be treated. I mean, with regards to the masseuse and the traditional medicine bit, that I'm probably not able to comment. But yes, for say women with systemic lupus erythematosus, have you heard of this condition?
No.
Yeah,
Too cheap, innit?
rheumatoid arthritis, autoimmune
Arthritis,
disease
yeah.
where they need steroidal treatment or antibiologics. So it's important to get this condition under control. And these women needs to be screened early for heart disease, and so that treatment can be instituted early to prevent complications later on in life.
If let's say my family has a history of heart diseases, does that mean like it's inevitable that, you know, we are going to get it as well?
Yeah, so if you have a family history of heart disease, we usually mean that the heart condition has occurred in the family at a young age. Usually, if there's somebody in the family who has heart disease at 50 years or below, or some heritable condition that has predisposed them to heart disease, then we may need to screen you and your generation of in the family. And actually, for patients who come in with this, I mean, usually they say that they feel a bit sad about it, right? I have a set of bad genes, basically. But knowing that ahead means that you can take actions to prevent complications early. So it's not too bad if you know that, this is familiar in my family, it runs my family. But you are already with me right now means we are already doing something about it. Yeah.
Okay, I mean, you talk a lot about pregnancy, right? If let's say, I mean, 2 cases here, right? You say pregnancy can cause heart diseases. And let's say now we are on the topic of my family has it. Then do you think if let's say my family has it, women shouldn't get pregnant?
No, definitely not.
Like, don't get pregnant or just go ahead with it?
Yeah, so there are some heart conditions where we absolutely do not recommend pregnancy. And these are cases where if a woman is pregnant with a particular heart condition, we feel that she might lose her life.
What are some of these heart conditions?
So pulmonary hypertension is one of them. And then there are some patients where they have genetically abnormal aortic root. The heart arteries can expand and dissect so that it can tear in pregnancy. And there are some patients where the heart function is very, very poor. So imagine during pregnancy, the mother's heart has to grow another mini human being and another heart circulation. The body is not able to support that. So there are some conditions, if they are already pre-existing, they are high risk for pregnancy and cannot go ahead. Or in fact, we may even have to counsel for termination to preserve the mother's life. There are some conditions where they can be managed. So it doesn't mean that even if you have a heart attack before, you cannot be pregnant. That doesn't mean that. Or if you have certain family history and your heart condition is not at the same extent, or it is manageable with surveillance and medication, you can still have a healthy baby.
I want to say that during my pregnancy, my heart tripped. This most recent pregnancy, like all
What do you
3
mean by you
pregnancies.
tripped?
Basically, I was diagnosed with SVT, which is tachycardia.
Name my doctor?
Supraventricular tachycardia.
Yeah,
So fast, yeah. Okay.
almost ventricular tachycardia. So basically, I have this extra nerve, correct me if I'm wrong, extra nerve in my heart, and then the electro functions of the heart short circuit. So instead of flowing through the heart, it just trips on that extra nerve.
Then how do you feel?
Very good explanation.
So then I had rapid heart rate. From like my resting heart rate was 158 to 198 BPM, and this was when I was just lying down. And
This after or before pregnancy? Before.
this is during.
Oh, during.
I was 35 weeks pregnant. During that week, my heart tripped 3 times. The first 2 times it stopped after 15-20 minutes. Then the third time, it went on for 5 hours until I went to the A&E, and then they had to like do the Valsalva maneuver. And they
What's that?
flipped me upside down. They put me on the bed. Then they made me blow through this huge syringe.
Yeah.
And then once the plunger reached the end of the syringe, they flipped the bed upside down, lift my legs up, and then tip me back over. So basically to let the blood gush to my heart and jumpstart everything.
yeah,
Right?
your explanation is perfect.
So you were 35 weeks pregnant.
Yeah, and they
you
had
were
to flip
that to
me.
you?
Yeah. So the A&E doctor was very scared. I remember she asked the other doctor, "Do you think the baby will be okay if we do that maneuver on her? Will she go into labor?" But yeah, it was fine.
So do you feel like when you were having this SVT, do you feel like your heart hurt? How did it feel like when it was tripping? Like, what is the feeling? Can you share?
My heart was just pounding.
Yeah, you're running lah. You're running lah.
But do you feel pain? Like uncomfortable?
Uncomfortable. Like I could feel my
yeah,
heartbeat
right.
in my nerve here, and it was just pounding like damn fast, non-stop for 5 hours.
And you weren't doing anything.
I was just doom scrolling in bed. I was just lying down. Okay, the first 2 times I just picked up something and then it triggered it. Yeah. And I never had this in my entire life.
So what actually triggers it?
Pregnancy, because the increase in blood volume. And then,
Right.
yeah.
She can be doctor already. Everything she said has been
that's
correct.
right.
That's because the doctors explained it to me.
So this SVT thing only happens to pregnant women or any random woman?
No, you can have it.
Men
just
also can have.
Yeah.
Oh.
Okay, and what triggers it?
Yeah, so what she described this SVT is a rhythm problem of the heart. It's a common problem and actually a good problem to have because it's easily treated.
Yeah.
Yeah. And if it's treated, it can be treated with no sequelae. That means you can be perfectly well after that.
Yeah.
It can happen in young people, so that's more of a young person's disease. It can also happen in old people, and it can happen for the first time when you're pregnant, or in any other activity that you're doing. So, with this rhythm issue, sometimes it tends to manifest more in pregnancy because the workload of the heart is harder during that time.
But what the doctor told me is it's not deadly, just inconvenient. Is that right?
Yeah. So it's quite a benign condition, and there are some maneuvers, as you described, that can help to abort it. And if it happens again, we can do the same thing again. Or it can be treated with medication or ablation. Like we can put electrodes in the heart and then we can apply ablation to the abnormal rhythm.
So I can IV drip or do ablation through the groin, right?
Through the groin vein, yeah.
What are the chances of death from SVT?
Low.
Not daily.
Very low. Okay, hang on.
Very low.
Because in my head, like, my next question is, should all women go for like heart health checks before they get pregnant?
Okay, not necessarily, but sometimes there are some women who are already at higher risk beforehand. So if they have a chance for pre-conception counseling, either with the OG doctor or their original family doctor, and certain risk factors are already identified, it might be good to do that. But as of now, we don't advocate for every woman to definitely have a heart screening before getting pregnant.
We move on to older women like Nuru.
Oh wow. Oh wow.
Rude.
We move on to women in their 40s like Nuru.
Hey,
That is a fact. Why you wow me?
you have to tell the world.
Everybody knows. Google your name. Everybody knows
thinks
it.
I'm 21.
Hashtag
Guys,
forever young.
as friends,
forever
are we
young.
going to tell her the truth or
Shut up, you.
I just won't
Okay,
say
go and
Okay,
hurt
women
me.
in their 40s, right? Can emotional stress like caregiving stress, marriage stress, financial stress actually damage the heart physically?
So it has been shown that stress does affect a woman more than men, especially when it comes to development of cardiovascular disease.
Oh, okay, just for the cardio part lah, but not necessarily just...
Yeah, but men can also get affected, but women do tend to be a bit more vulnerable.
Heart
Yeah.
fragile.
And in fact,
hate that you say
there is
that.
a particular condition where a woman is severely stressed, especially post-menopause, and the heart can just balloon out and lost its heart function.
What?
Yes, 90% of the time, this condition affects women and not instead of men.
What do you mean balloon out?
Yeah. So we call this condition stress-related cardiomyopathy. Like the heart is a very nice pump most of the time, and when it's stressed and it suddenly just dilates and like a balloon, and it just loses its function at the time. And it will manifest as if it's a heart attack.
Is that the broken heart syndrome?
Yes, that's right. Yeah. So that's what is fondly
Dr.
being
Esther.
called.
What? Oh wow. And that happens for women in the 40s.
Much more for women than men, and usually postmenopausal women.
Oh.
But can this happen? Sorry, can this happen to a younger person as well?
Less likely. But the exact question was, are women affected by stress? So I tell you there is evidence that women can be affected by stress.
I can
much more than
smell
men.
the comments coming in.
I'm curious to know
Ah.
what percentage of the 1 in 3 women are married.
That's a great question.
Please answer for the younger generation.
I don't have the answer.
Yeah.
But love the woman well in your life. Yes, yeah.
Wow,
It's
but
worth an investment.
premenopause actually can cause that.
So premenopause, we don't see broken heart syndrome as much. But I would say when it comes to stress or depression-like disorders, I would just take an example. For example, if a young woman has heart attack compared to a young man has heart attack, there have been data showing that a woman suffers from depression much more post-heart attack than men. So stress and emotional stress and depressive disorder does affect a woman more significantly.
Okay.
Good thing, y'all.
So be nice lah, guys. Be nice to the
You be
ladies.
nice.
Affect women more than men. That does not mean that men are not affected.
I don't care about
Wait, I have a question though. So example, you say like the heart balloons up, then is there a risk of a person passing away from that?
Yes. Confirm.
Oh my.
Wait, so
When you say lose all function, you mean just
Yeah.
Pass.
It just dies.
Heart function
just
can go down
fails.
significantly.
when it balloons up, do you actually see it balloon out?
We can see on heart pictures on imaging.
Oh my
Also, it doesn't come out of your body lah. It's just. It's,
Hey, dude.
do I look like a doctor? Do you all look like? You all never thought about that
I'm
question.
so sorry. I think he
I
feel
didn't
like it's
think
like the
it would
movie like
balloon out of your body.
Okay, then
You watched too much Tom and Jerry
Balloon
when you were younger.
Okay, explain to me
Of course,
what
it
a
will
balloon looks like.
It will balloon
It
out
is
inside lah.
Expand.
Yeah,
Do you
so
How can it balloon out of your body? That balloon.
okay. How big can a balloon go? Big, right? And your heart is also a muscle, right? So you can pump and pump and pump and pump. Is this a wrong question? I think it's
It's not a wrong question. It's a
it's
stupid
warranted.
question.
Hey, it's warranted.
No question too stupid for doctors.
You see? What about hormonal like profile and menstrual like history? Does it affect like heart
A
health?
sensitive new age man.
Good that you're asking this.
Am I now not doing my job, guys? What the
No,
fuck?
no,
No, it was a compliment.
Everybody was
That's
impressed.
yeah.
Oh,
It
that-
was a
I was like, wow, you
See?
care about us women.
Yeah, menstrual, all
It
he's
was a
asking for
compliment.
us.
Yeah, so sometimes in the clinic, I have couples that come in, husband and wife, and it's the man who asks the question when it comes to menstrual cycle. It's really quite impressive. Yeah. So I wouldn't say that there are chest pain syndromes that are associated with the menstrual cycle, but related to women hormones, I think the most important thing to be discussed is just perimenopause. So the female hormones actually protect our heart health really well. They are like our guardian angels. But by the time we reach close to 50, or around 45, when perimenopause starts, then the female hormone starts declining and our risk suddenly escalates so much more. So you also realize that by the time you are reaching mid-40s, you do put on weight a bit more easily. And yeah, so there's a higher tendency to build abdominal obesity. Blood pressure seems to rise. When you check your cholesterol on blood tests, it's going up even though you're not eating more. So there are metabolic changes, hormonal metabolic changes that occur around the perimenopause age. So while we cannot do very much about this perimenopause period in terms of you can't boost the hormone levels again, but we can take actions to just make sure that the cardiovascular health is, being maintained. Yeah.
So, correct me if I'm wrong. So for men, right, when our hormones drop, right, I mean that there's TRT, so like testosterone replacement therapy, right? A lot of men in their 40s take it. Is there
Estrogen.
a version for women? What if they take estrogen in menopause, during menopause?
Yeah, so this hormone replacement therapy has always been a point of contention, whether that is going to be helpful for heart health. But at this point in time, it's not advocated. Usually it's the OG doctor who makes the prescription rather than the cardiologist. And it's usually for women who have got menopausal symptoms. Flushing, vaginitis, mood changes. So not related to cardiovascular disorders. So cardiologists usually don't prescribe hormonal therapy. It's not been shown to work. Unless a woman has early premature menopause, then it would be good to just replace the hormones early.
Interesting.
Actually, menopause is unescapable, is it? Like everyone goes through it, or
Yes.
Yes, you.
okay?
Do you know why menopause happens, right?
I
Because
don't
we
know.
have a limited amount of eggs in our lifetime.
So we run out of it.
Yeah, we run out of eggs to
So
release.
then your body is sad.
So then our menstrual cycle stops because we no longer need to release the eggs because we don't have any more eggs.
And then your
So
body
there's a
gets sad.
lot of hormonal changes.
It's not sad, dude.
So then menopause.
Elevated.
Yes.
Your feelings get elevated.
Yes.
Everything.
It's not sad.
The
it's
heart
just
disease.
big feelings.
Actually, menopause triggers a lot of things, right? It's like a lot of things will happen to women.
Yeah.
When
So
you're
not
going to
everybody has menopausal symptoms when it comes to the perimenopause time. But I think there's just so much more talk about it now because people are more open. And so there's more awareness that this is an important milestone of a woman's life. But from the cardiology point of view, usually we want to advocate that in this important milestone, you can do a lot more for your heart health because that's when cardiovascular risk suddenly rises exponentially. Yeah. Before menopause, actually women are less likely to be affected by heart disease compared to men. But after menopause, we catch up.
Wow.
Immediately.
Quite quickly.
Oh my God.
Interesting.
Wow.
Yes.
So what do we need to do to prevent that? Or how do we make sure that that doesn't happen? Or how do we take care of our heart health?
Yeah. So
In
screening
the
is
40s, I guess. Yeah, in
Yeah,
the
in the
40s.
40s. So screening is really good. Usually by 40 years of age, we advocate that most women should have at least once a year blood tests for fasting bloods, fasting glucose, fasting cholesterol, check blood pressure, weight, and waist circumference, and with a good history or assessment by a cardiologist, usually we'll see whether there are any other risk factors we need to manage. And some patients, if they look like their risk profile is high, they may need to have a cardiac screen. Not everybody has a high risk profile, but that means that you're in good shape, and then you should be encouraged to keep a healthy lifestyle. Yes.
Why do you keep repeating waist?
Waist.
Yeah.
Because, sometimes it doesn't mean that you're skinny means your cholesterol is low
Yeah.
and that you don't have diabetes. And waist circumference is belly fat. It is very predictive of cardiometabolic health. Yeah.
And wait, hold on.
Like
So-
visceral fat.
Yeah.
A lot of fats are stored there.
We always find that, actually men and women the same. As you grow older, like it's easier
Your
to put
belly.
on at the belly.
Yes.
You can have a skinny face or small shoulders, but when you have your little like belly,
Pouch, yeah.
yeah, that is actually predictive of your cardiovascular status to a certain extent. Yeah.
Oh my God.
Yeah, so having a
it's-
small waistline is not just like sexy, it's like it's healthy.
So I have a question now. Like, how do we test for any cardiovascular?
Go for
Disease.
testing. Repeat.
Screening.
No, like what kind of screening?
Blood test.
Blood test.
Blood
ah?
test. Listen.
Waist circumference.
Family doctor can do the screening bit first and they will be able to direct you whether you need to see a cardiologist.
Wait, but I think what's more important, I think what's the easy thing to see is the wasting, right? I mean, and I realize you keep repeating it, right? So I'm going to assume it's very important and it's the easiest way to spot,
Yeah, you can check it yourself.
right? Okay,
Oh.
but what am I looking out for? Like, is there a shape to it? Is there a certain number that...
Yeah, it's just a number.
Okay.
So generally when we measure a waist, we are measuring tape loosely across without sucking in, okay? Cannot like, that's cheating. Okay, so fully exhale and it should be the level between your hips and the lowest part of the ribs. So actually the level is at your navel button.
Belly button. Okay.
At your navel button is actually not the smallest part of your body. It's a little bit lower down, right? At the navel button. So it's just measure over there. For female, it should be less than 80 centimeters. For male, it should be less than 90. So if you're within these numbers, you're safe.
Okay, we need to
80.
get a measure.
But what if that,
So you wanna
go
see
home and
another
check?
thing.
But what if
Hey, no way, like-
that person is bigger in size? Is it still 80?
Yes. That's a
mean,
general number.
Obesity.
Obesity, I think is a telling cause, lah,
Yeah,
right?
80, is it?
80 for women.
Actually, you're not...
What measuring tape?
You're not 80 lah.
Is
Come on
it?
lah. You're at least 60 plus lah.
This woman, I don't know what
No,
she's
this
talking
one, this
about. No.
Yeah, you're at least 60 plus lah. Relax, man, relax. You're safe. So one question that we posted about this episode on social media, and I think one of our followers asked, are there any success cases of pregnancy with metal valve replacement? I think firstly, let's explain what metal valve replacement is, because I don't think any of us know that.
Yeah.
And then you can answer if they were successful or not.
Okay. Yes. I'm so glad that question is asked. Okay. So we have 4 valves in the heart. So valves are what we call like doors of the heart. They open and close so that when a heart pumps and relaxes, blood always flow in one direction forward. So when the
Okay.
heart pumps, the blood should go forward, right? So there are 4 chambers inside the heart. And between these chambers, there are heart valves. So when the heart pumps, the blood should go forward. But when the heart relaxes, the blood should not go backwards. It should just receive blood. And when it pumps, it goes forward direction again. So the heart valves allow the blood to move in the correct direction. And when the valves are dysfunctional, severely affected, either they don't open well or close well, they need to be replaced. And so for a young patient, sometimes we do this thing called a mechanical valve replacement. And so they have like a prosthesis in the heart. So that is what I think is meant by the metal heart valve, a mechanical heart valve. So these patients, their heart valves, they click really loudly. You can sometimes hear like a clock. Yeah, because you can hear the click as the heart pumps. And traditionally, for a patient who has got a mechanical valve replacement, they need to be on very strong blood thinners, and that's harmful to the baby. And it used to be in the past, we do not recommend that these patients undergo pregnancy. But right now, we are very good at managing this condition. So I would say that there's usually no problem with seeing them through pregnancy, but there are some risks that we need to take care of. So it will be considered a high-risk pregnancy, but it can be managed with a proper tertiary team.
Does it mean they have to go through C-section and not natural?
No, not necessarily. They can go to natural birth.
Because of epidural, is it not as stressful for the
Yeah,
heart?
but they can go through natural birth. Yeah.
Okay.
It's nothing to do with the labor pain control, but epidural is possible.
I want to meet someone with that ticking heart.
Oh, you want to
Interesting.
hear?
Wait, so if they have a ticking heart, sorry for using it, can they exercise?
Yes, they can.
Okay.
You can exercise after a heart valve replacement, after a heart bypass. Even if your heart has ballooned out with stress and is returned back to normal, you can go back to exercise. You should be able to go back to your normal lifestyle as much as possible.
Wow.
And what if that machinery crashes? Yeah.
Malfunctions.
Yeah, so if there is if there's a prosthetic heart valve, it can run into problems. And of course, if it runs into problems, sometimes the valve needs to be replaced, or we need to give certain medication to make sure that it's working well again, especially when it comes to blood thinner, managing of blood thinners in this group of patients. So they can run into problems. It doesn't mean that, it's like a heart that will work forever. But they can be managed.
Now, I would like to assume, right, people in their 50s who have heart problems, right? Is at the age, right? Assumption, right? Is at the age where they go like, yeah, my time is coming.
Just accept it.
Yeah, like this is fate. My time is coming up. I shouldn't do anything about it. How often does that happen? And or rather, how often does heart diseases happen in their 50s and there's still time to save it?
Definitely time. There's always time.
Okay.
Always time. Never too late. Yeah. So actually, most of the patients we see in hospital are definitely above 50s.
Okay.
But the message we want to tell people is that before problems start in the 50s, 60s, 70s, actually the work starts in your 20s, 30s, and 40s. And at 50s, you are still smoking and you stop smoking, it still works. At 50s, you're obese and you start exercising and lose weight, it still works. So it's never too late.
Does your heart know your age?
I would say, there are some people who believe that, when I'm older and I feel a bit more breathless, of course, because I'm older, my heart is not as good. But that's definitely not true. So I think your heart, the age of your heart and your body can be younger than what you actually are. And you can do that with good, healthy lifestyle.
Wow.
Yes. So
So interesting.
The heart is a muscle, right?
it is a muscle.
Right? So technically, it's like you can train your muscles.
Yes.
So the funny thing about people in the 50s or 60s, when they come in, sometimes they say, okay, I want to screen for heart condition. And then you find a risk factor that you want to manage. And then they'll be like, but my heart is still okay, right? Although my cholesterol is high. So don't need to take medicine first lah. Or the blood pressure is a bit high, don't need to take medicine first because you say the heart is still okay. So the problem is, I think for this group of people, when they come to see a doctor, the moment we identify a risk factor and a doctor says that you have to take medicine, please take the medicine. They rather have the screening again and again and keep telling you that the heart is fine. But they are not willing to start management of the risk factor. And hypertension, diabetes, cholesterol, this simple risk factor control, they are what we also call shadow killers. There is no symptom at all. Your first symptom is a heart attack. Then when a heart attack occurs, then you say, okay, I want to do something about it. That's too late. Yes.
What's this? So I mean, talk about heart attack, right? If let's say, what are the chances someone survives for the heart attack? In all honesty.
If you come in early, most of the time we should be able to save you.
Okay, but is it like what you see in the movies where they get a heart attack and they immediately die? Or is it like a 2-hour, 3-hour buffer?
It depends,
You know what I mean?
right?
No, I don't know. My grandmother and my husband's grandmother both had heart attacks and they had a triple bypass and they survived. Triple bypass surgery.
Because I hear some people, they have heart attacks and they go to the clinic and 2 to 3 hours later, and they were like, oh, you had a mini heart attack. What do you mean? Like, then how am I still alive? So are there different levels of heart attack or what?
There are. So that's a very nice way of putting it. There are different levels. There are big heart attacks and there are mini heart attacks. And there are heart attacks where sometimes a certain part of the heart muscle just is severely affected. And there are some heart attacks where it only affects a small or half a section of the heart muscle, for example. So the ones that are mini, usually there's no need to, put a balloon or a stent through the coronary vessels immediately, but usually within 24 to 48 hours. For the ones that are like major heart attack, usually they have to get to hospital within an hour, if possible.
And how does the heart choose which level to go?
Depending on how narrow your coronary arteries.
Or rather, what's
blocked with plaques.
what's the early symptoms of a heart attack? Because I remember my grandmother, she complained of toothache
Yes.
first. My grandma complained.
Yes, I know. Toothache, and then it spreads to the left of your shoulder.
Like stroke.
Yeah,
Stroke is heart attack.
and your biceps here.
It's part of the same spectrum where basically blood vessels of the organ is affected. But you're right. So heart attack is not obvious to women especially. Sometimes we always say chest pain is the most common predominant symptom. So it can be very obvious for men, but for women, it can be a little bit more subtle. Again, it can be, while chest pain is the most common presenting complaint, they can also have jaw ache, toothache, left arm pain.
Yeah.
Sometimes just gastric discomfort or just overwhelming tiredness and breathlessness.
What?
And because there are all these other non-specific symptoms that accompany the chest pain, maybe female patients just don't get alerted that it might be a heart attack as much as men. Men is like, I have chest pain, I'll go to the hospital. Women is like, what is this?
They flew or so. They're
Yeah,
like,
yeah,
okay, no.
No, you know, there's a very sad story of this bodybuilder. I mean, he's a guy, right? So he was on video teaching people how to work out, and he just kept saying, my lord, my left bicep hurts, my here hurts, and everything. And everybody in the comments was like, dude, it's coming. Go and get yourself checked. Too late, boom, heart attack, died.
Is it always the left
The
side?
fitness
it's a-
influencer, right? The
Left side.
overseas one. Yeah.
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 So like recently, my friends also kept calling me, oh, very pain. And when I raise up my hand, I'm like, hey, go and get checked. You don't know, really don't know. You really don't know. Especially if you don't work out, I think. If you work out, right, some people can pass it off as like, muscle soreness or anything. But if you work out and you, I don't know, take steroids or anything, go get checked, right? And if you don't work out, go and get checked. I feel like this too is a...
Yeah, I read on TikTok, somebody commented, I was on this rabbit hole of like heart problems. So I always have this scapular pain, right? And then someone on TikTok said that they had this issue and then they realized it's related to the heart.
Yeah.
Or your chest lah.
Yeah.
Wait, so you mean your scapular,
it's
Shoulder,
it's-
more like shoulder related area.
constantly in
like
pain.
chronic pain?
Yes.
What?
And then someone said, they finally realized, or they finally, after seeing so many doctors, got diagnosed with something. I don't know what's that thing, but it's related to the heart.
Yeah, so sometimes it's not obvious. It's not necessarily chest pain and the central chest that's obvious. So it's just good to be aware of that so you can get your heart checked. But when we say left arm pain or shoulder pain, usually this pain is not reproduced by changing of your arm position. That's like muscle pull. Yeah. You may get the pain when you exert and the pain comes on. And then when you rest, the pain disappears. So that may be something that's coming from the heart. Because the pain is manifested when the heart is doing more workload than usual.
I have one last question, which is going to be quite sensitive, right? But I think it's very important. So because...
No questions are too sensitive for doctors.
Okay, so just for some context, right, I did my circle
DNA.
and in the report they tell me what minerals I'm lacking, so on and so forth. And when I Google these minerals, right, it showed that generally Malays lack CoQ10.
What is that?
It's a mineral. So now I take... I'm not a doctor, I can't explain it to you.
Okay.
So now I take supplements to feed my CoQ10 and also my omega-3. I lack omega-3, right?
That's
That
great.
explains.
I also take omega-3 every morning. Now, when it comes to heart diseases, are there certain ways that often shows up?
There is.
Can I make a wild guess on which race often shows up, I would say it's the Malay race.
Based on
Because
their
of
diet.
the food that we
That's
eat.
one. Malays also play a huge, not say play a huge, but contribute to the most number of diabetes patients in Singapore. Yeah. So I
That
would
makes
say
sense.
Yeah.
Is it?
Yeah, he's quite well read. Yeah. So we are multiracial, right, in Singapore, but two races do stand out a little bit more. Indians and Malays. Obesity rate is much higher in Malays and Indians. I'm not sure it's just, is it our lifestyle?
It's the
or
food we eat. You know, all the santan, the lemak, so delicious. Huh?
And the Chinese like
Soup,
soup.
vegetables.
Yeah. Herbal soup.
You get what I mean?
There's no Malay herbal soup, right?
Yeah, don't have.
Yeah, don't have. Really don't have.
And the sugar intake, is it? That's why you say diabetes rate also.
Yeah.
Yes, and
The obesity rate and the lack of exercise, we do see more in Malays and Indians. And also actually Indians have a tendency for high cholesterol, high lipid levels.
yeah.
Yes.
And I think it's very important, right? Because genetics play a huge part in what you get or don't get. Yeah, and like I said, I did my DNA test. So much information actually, and I advise people to go and do your DNA test. Go and
Should we get a-
what your
Heart test too.
yeah, and get a heart test also.
Yep.
Yeah. So we've come to the end of this episode. I hope you guys learned a lot because we did.
A lot, yes.
I think the biggest takeaway here is I think, okay, no matter how healthy you are, no matter how unhealthy you are, just go and get checked.
Yep.
Right? I think checking is one of the easiest thing or the best thing you can do for yourself. Check for everything. Right? The best thing you can do for yourself as you age.
Yes, and after checking, whatever advice your doctor gives you, please do it.
Listen.
Take your medicine.
Yeah. Or you can do your DNA test also and then go and get checked also. Yeah, then you can fully know about
Exercise.
yourself. Yes. Thank you so much, Prof Low, for coming in and sharing your knowledge.
Thank you.
We would like to wish you guys a hearty. Wow.
No pun intended.
International Women's Day. If you guys have any questions or anyone you'd like us to invite, let us know in the comment section below. If not, we'll see you guys in the next episode.
Bye.